This presentation discusses Patrick's case. Patrick is 78 years old man. He has diagnosed chronic obstructive pulmonary disease, COPD, and worsening of his left-sided heart failure. His legs are swollen from his knee down, and his blood pressure is 135/85, pulse is 155, his weight is 95 kg, height is 180 centimeters, and the waist circumference is 104 centimeters. He has history of myocardial infarction and he has smoked for 40 years. He is suffering his respiratory symptoms such as cough and dyspnea. There are various factors that cause these symptoms such as long-term smoking, age, insalubrious eating habit, and lack of exercise. Among them, long-term smoking is the main cause of these symptoms. These factors can be cause of increasing LDL, and high level of LDL can affect obesity. His BMI is 29.32 and his waist size is 104 centimeters, so he is obese. Also, obesity may cause high risk of COPD and heart failure. Because of COPD and heart failure, he has cough, dyspnea, as well as fatigue. Since his pulse is 155, which are higher than normal heart rate, he is tachycardia. As with the causes of respiratory symptoms mentioned above, long-term smoking, poor eating habits, lack of exercise, and his age may contribute to increased heart rate, as well as blood pressure. These factors can have an effect on the body. The nicotine in tobacco stimulates Patrick's body to produce adrenaline, which makes his heart beat faster, making his heart work harder. Patrick is likely to be suffering from peripheral artery disease, which is evidenced by his increased LDL and triglyceride, and decreased HDL, leading to atherosclerosis because of fatty deposits in the arteries. This makes the heart work harder to pump the blood to body tissue and contribute to an increased heart rate.
Before interpret relationship between COPD and his left-sided heart failure. Left-sided heart failure is occurred when left ventricle cannot supply blood to the lungs efficiently. As it has been mentioned before, smoking, aging, and obesity would be the main factors of insufficient blood supplying to the lungs. Since he has a high level of LDL, it also affects his left-sided heart failure. Also, those factors may lead to COPD, especially long-term smoking would contribute to COPD, which causes shortened breath. Even though COPD is not straightly connected to left-sided heart failure, both conditions may influence each other and often exist together. Low level of oxygen caused by COPD may put more pressure on the heart, which can deteriorate left-sided heart failure, and it can cause right side of the heart directly. We will discuss more about right-sided heart failure on the next slide. Left-sided heart failure is the main reason of the right-sided heart failure. Therefore, since Patrick has a fail in left side, he has a high risk of right-sided heart failure as well. When the left ventricle fails its function, there would be an increase of fluid pressure. Then, blood will return back to the lungs and eventually damage the right side of the heart. However, if there is heart failure on the right side, the muscles in the heart will be weakened. Once the muscles are weakened, right side of the heart loses function to pump the fluid. The blood may go back through the body's vein, and it commonly causes swelling in the legs and feet, ankles, as well as abdomen.
The three factors that have the greatest impact on his neurological function are long-term smoking, lack of exercise, and poor diet. His blood test results show how these factors have affected his body and how it will affect his body. The high LDL levels induced by all three factors can cause hormone imbalance. Hormones are chemical messengers inside his body. Therefore, they transmit information that regulates the function of most cells and tissues in the body. If they do not work neurological function efficiently, neurological disorders such as depression can occur. In particular, the problem of unbalanced dietary habits appeared through many abnormalities. The high sodium level that can cause seizure is also called hypernatremia. Hypernatremia may occur mainly when a person has lost too much water or has increased salt intake without enough water. Nerve cells particularly sensitive to large amount of sodium, which can cause problems. It is because they require electrolytes to function properly. A large amount of glucose also adversely affects the brain because it is associated with diabetes. Having diabetes increases the risk of damage to the small blood vessels in the brain, and it also causes problems such as confusion and memory loss. These symptoms are also associated with low calcium levels. It is a common symptom of calcium deficiency in our body. In addition, fatigue and anxiety disorders can also happen. If the hemoglobin level is low, it is easy for people to feel fatigue and uneasiness. In his blood test, sodium and potassium levels were high. It can be assumed his kidneys would have been damaged. Sodium and potassium are essential for our body's function, but too much cannot remove excess amount from the kidneys. Sodium and potassium will accumulate in his tissues and bloodstream. Therefore, he has a high normal blood pressure of 135/85, and his blood pressure will be increased for these reasons. Eventually, the kidney may not function properly. If there is kidney failure, blood tests show high creatinine levels. Thus, his creatinine level may be assumed to be high.
This is our reference list. Thank you for listening our presentation.